One of the questions we get asked the very most is, do you have a therapist you can recommend for me? And while we wish that we knew of therapists in every single place, in every single part of the country, we don't. So what do we tell them instead, Mel?
We say check out BetterHelp because it's online, it's at a reasonable price, and you can be matched with a therapist within 24 hours. I've also used them and they have been great. And if you don't like your therapist, guess what? Click, and get a new one.
Absolutely. It's so hard when you have an in-person therapist, if you're not clicking with them, to cut them off and get a new one. So that's not an issue with BetterHelp. So we always tell people to try BetterHelp. And if you use our promo code, which is
trybetterhelp.com/WWDN,
you get 10% off your first month.
Go ahead and try it out. That's trybetterhelp.com/WWDN. And you know what? I'm a big fan of doing therapy where you don't have to wear pants, but nobody knows about it.
Are you wearing pants right now, Mel?
I'll see you later. Bye. That's trybetterhelp.com/WWDN.
We're going to have a fun time talking about kind of a crazy topic today, Mel.
Yeah, I've actually been curious about this because I know you've mentioned it to me before when I was struggling, and now it's kind of something that's pretty popular. So
yeah,
introduce it for us, Anita.
Oh, introduce it or introduce our guest?
Maybe our guest, and then she can introduce the thing.
Okay. Well, our guest is Carolyn, and Carolyn has a cool last name. But hi, Carolyn. You want to tell us who you are?
Hi, I'm Carolyn Recksiek. I'm a marriage and family therapist here in Utah, and I do ketamine assisted therapy and psychotherapy with Anew Therapy Utah. And here at Anew, we specialize in kind of alternative treatments to address mental health and physical health. Yeah, mostly one thing we specialize in is ketamine, and that's kind of that weird thing that,
Yeah. That's what we want to talk about.
That's what we're going to talk about today. And I was in that same boat. Like, excuse me, ketamine, you do what? People do what now? And I really do love it and have a huge passion for it. So it's going to be fun to talk about it.
So, Carolyn, you are a non-widow, correct?
I am a non-widow. I am.
Congratulations.
Thank you. I have lost a baby, so I'm familiar with grief and complicated grief. So I'm like actually really excited to like kind of explore mental health and grief. But yes, thankfully non-widow because I had 5 kids and I'm like, I don't want to do it alone.
You don't want to be like Anita.
You don't want to be me.
Nope.
Also, we're sorry to hear about losing the baby. That's really tragic and hard.
It's really not very much fun. Grief is not a fun process. Losing an important part of your family and your home and your life is just the pits.
Were you already a therapist when you lost your baby?
I was not.
Okay. So did it kind of direct you into that field a little bit, or was it not related?
What's interesting is not necessarily. It directed me into going back to school. And so I went back to school and got a bachelor's degree in healthcare management. And I was like, what am I going to do with a bachelor's degree in healthcare management? And I'm like, I have a bunch of kids. Like, I don't want to go leave them 40 hours a week, right? Like, and one of them, has autism. So I'm like, it's just a 40-hour week job wasn't my thing. And then as I was finishing, I'm like, well, school was kind of fun as an adult. And what do I want to do next? I would like to have a job. And someone suggested therapy. And at first I was like, I don't want to be a therapist. My mom was a therapist. So I was like, actually, it was probably my mom who suggested it. And so little stubborn, I was like, I'm okay.
No,
I don't need to be a therapist.
Ew.
I don't want to be just like you. That's disgusting, right? But I did. I decided to become a therapist and I love it. Yeah. I think a lot of my passion for what I do stems to losing our baby. But yeah.
Fantastic.
Yeah.
Thank you for your backstory.
Of course.
Have you always done the ketamine thing, or you knew, well, not new to it, but it's kind of a newer therapy?
I am newer to it. So my master's degree is in marriage and family therapy. So I thought I was going to do just a lot of couples work, a lot of family therapy. And really quickly, I did, like my clientele became suicidal teenagers.
Fun.
And then I actually love it. I know which is maybe a morbid thing to say, but love it. But I'm also just a couple months away from completing a doctorate in traumatology. And seeing all of these like suicidal patients that just, it didn't matter how much therapy we did, it doesn't matter what medication they were on, like we were not making progress, they weren't having relief. And that's really, really frustrating. And so I was like searching alternatives and came across ketamine. And I referred clients. I'm like, go try ketamine. You know, the research is really great. I don't know much about it. I'm a Mormon mom of five. I don't do drugs. So like, go with God, right? Like,
Good luck.
and I actually had a client who we were finally making some progress, but felt like maybe ketamine would be like that thing to get us over the top of the mountain. And it was a really horrible experience. And so I did even more research and I was like, oh, okay, like ketamine is a really effective tool when done properly. And there are certain populations, certain demographics, like suicidal people or people that have trauma that need a little bit more support in the ketamine. And so I had kind of done my own research, but I hadn't really found a clinic that I was like, I would refer a client here just because I don't know, I just felt uneasy about it. And then one of my dear friends is a medical doctor and reached out and said, hey, I'm opening up this ketamine clinic. Obviously, ketamine helps mental health. So we're just, looking for a consult and like what you think. And I'm like, do you really want to know what I think? So I gave them probably more information than they wanted and they implemented everything. And now I work here.
I have two versions of this scenario. So I have one friend who is a recovering drug addict, and I mentioned, hey, this is a therapy. And he immediately was like, no, 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 don't ever do that, because he had come from street drugs. And then I have another friend who was doing trials of it in another state, in Virginia. And it was the first thing that had helped in years and years, and lots of wrong medications or over medications. So tell us what it is exactly. Is it a street drug? What's the deal with ketamine? We need to know.
Ketamine can be found illegally on the street, right? Just like Adderall can be found illegally on the street. Ketamine, kind of its original form medically, is in anesthesia. So if you are put under at the hospital, ketamine is part of the component that they use to put you under. If your kid breaks their arm and they take you to the ER, they'll actually give your child ketamine to kind of numb things out while they set the bone. Especially during like war, it was a really great option for anesthetic because it can be given like in an injection form, right? And so people were using it in war. And then science evolves. One day someone's like, hey, I wonder like what this would do for mental health. And clinical trials started happening in low dose, right? Like really, really, really low dose to see if it would improve mental health. One thing that's really interesting is like antidepressants and stuff, like work on blocking certain receptors or like inhibiting things or exciting things. Ketamine actually helps the brain either repair neural pathways or create new neural pathways. And so it's a little bit different science. Yes, Anita.
Back the truck up, because you just said, and they used it for sedation in the war. And then somebody thought, I wonder what this will do for mental health. No, what in the world? Who came up with this idea? This is where I always get hung up. I'm like, who was like, hey, there's this really trippy drug. I think if we give it to people and they have like a real weird experience, they're going to feel better. Like who?
Here's the thing, Anita. There are people out there that are way smarter than I am, right? And they understand like the chemical makeup and breakdown of certain drugs and chemicals.
Okay.
And they understand how that works on the brain. I am not one of those people.
Okay.
But like some really, really smart medical doctors like, hey, I think based on what we know about blah,
Maybe
this,
might work.
a hippie and a doctor got together.
See,
and they came to the middle ground of the Venn diagram.
That's what I kind of wonder. Like, I've always wondered if it actually came to be kind of like through a backdoor method. Like, people were maybe using it as like a psychotropic experience, and then they were like, actually, I feel better now. So I've always wondered if it's come about like through super smart scientists or some dude in like a van somewhere.
If it did come from some dude in a van, they do not.
Let's call him Larry.
They don't typically like publish that in clinical research.
Yeah, well, I know. I'm sure that if Larry invented it, then Larry had to have he had to talk to his doctor friend Earl, and then Earl was like, "Let's do some studies."
Studies.
Yeah, because now it's got like medical
credibility.
Yeah. Yeah.
Yeah.
Okay. Thank you. This has just been something I've always wondered. It's also like, why did we start eating seaweed? Or, you know what I'm saying? Like a lot of things. Like, who
Yeah.
thought of this?
Yeah. Who knows who thought of it? So yes, here's the thing. I'm a little bit more conservative, so I'm always like, well, I don't know if it was Larry or wait, was it Earl
Earl.
or the one
Yeah,
or Earl?
Earl.
I don't remember. I don't know if it was Larry or Earl, but I'm like, I'm really glad that there's a lot of clinical research.
Right.
Like to me, I wouldn't feel really comfortable just like if someone was like, hey, go do ketamine on the street. If someone's
No,
gonna
thank you.
like go do weed, like I'm not gonna do this.
You're not going to do ketamine in the van with Larry. You're going to do it with Earl.
I'm gonna do it with Earl. Yeah,
Okay.
with like
Okay.
medical professionals monitoring me and like, you know.
So, do we know why it works?
I mean, do you want like the really boring, like
Yes,
sciencey?
I
Okay,
do.
so it impacts the NMDA receptors of the brain.
Okay.
And the NMDA receptors of the brain, okay, I'm not the medical professional, so those receptors are a large part of memory and learning. It also kind of interacts with the glutamate receptor as well. And glutamate's kind of like one of the central proteins of the central nervous system. And glutamate is kind of like the exhalatory part of our body. So it's like if we need a muscle to contract, glutamate's responsible for making that. So yeah, the ketamine excites those parts of the brain. It's like, oh, okay, like we need to get things moving and shaking. We need to do things. Ketamine, again, is also an anesthetic. It's also a pain blocker, but the pain receptor for the body is the same for like physical pain and also like emotional pain. And so this is where I really like it, right? When we kind of get into the trauma or hardship of life, we all go through hard things and the body keeps track of it. And sometimes those hard things are too much and the body can't process it and store it as done. So the trauma and the wound is kind of they're activated. And so if it's an emotional wound, the body feels pain. Right. And then the body's like, I'm not safe. I'm not okay. I can't do this. And so ketamine helps block the pain receptor so that we can tolerate feeling those painful emotions a little
Hmm.
bit more. And then it also helps excite things. So it's more willing to like, it can finish processing it. And again, make new connections, new insights, new patterns.
I'm going to make a comparison that is equally nerdy to the NMNA receptors.
Mm-hmm.
Close enough. So I work in wound care and we deal a lot with chronic wounds. So somebody might have a wound on their ankle, and at some point in time, if the body stops recognizing that as a wound, it will not heal.
Heal
So
it.
sometimes what we have to do is we have to go and we have to poke the wound and we have to scrape it and we have to say, hey, body, recognize this as a wound. Because if you don't recognize it as a wound, you're not sending the resources to fix the wound. And so we have to kind of reinvigorate the inflammatory process to help the body recognize that there's a problem and it needs to send the resources to fix it.
I love that. Yes.
Yay.
Love. I think I need to leave. Anita's way smarter than I am.
No, I couldn't even remember NMDA, so keep
Yeah,
going.
no, I think but that's really what we do with emotional stuff, right? Like I don't want to feel this, I don't want to experience that, especially things like grief. Grief sucks, right? And it's like a really, really intense, painful emotion. And then when you lose someone in your life blows up and you're trying to figure out how to just like keep all the pieces moving. And so the body's just like, well, we'll just like tuck that away. We're going to forget about it. We're going to try and avoid the emotional pain and the distress and move forward. And then it comes out in other ways, right? It comes out as anxiety, it comes out as depression, it comes out as PTSD or, relationship problems. And that's probably the hardest part of ketamine is it brings it to the surface, so the brain has to address it.
Is it a pill? Is it injection? Is it like a pill based on ketamine with other things in it? What
Do
is
you
it?
lick a frog?
Yeah.
Like a frog. You can find it different forms. Here at Anew, we have two different versions of ketamine that are available. One is Spravato, which is actually FDA approved. It's a nasal spray essentially. And then we also do intramuscular here. So you get one shot, lasts about 30 minutes, get a second shot, lasts about 30 minutes. And that's considered one treatment. Some clinics do like an IV form. You can get like a little, like a lozenge type thing that's even a more mild dose that some people will administer like in a therapy officer at their home.
What are the ranges of dosage?
I don't know the ranges and doses off the top of my head, but I do know that like what you would get to address mental health is like 6 times less than what you would get going to the hospital for anesthesia. It is a way smaller dose starting out for any mental health treatment versus I've got a big physical wound that needs to be addressed.
So Mel kind of alluded to this before, but like who benefits from this and who should not be using this?
Kind of right off the bat, if you have uncontrolled hypertension, if you have like major cardio issues, if you have psychosis or schizophrenia, you're probably not a candidate for ketamine right off the bat. Controlled hypertension, you're going to want to go through medical evaluation. And anyone that's like fresh out of a crisis, right? If you've just lost a spouse 2 weeks ago, that's a little bit too early to try and do something like ketamine, right? Like there is a level of our body needs to feel the pain, our body needs to process before we can identify if this is something that's kind of more treatment resistant. So ketamine is a really great option for those of us that have a long mental health history, right? If you've had anxiety and depression that you've done multiple medications for, you've done therapy, and like sometimes you can have, a decrease in symptoms, but they're always there. Ketamine's a really great option. If you have chronic pain, ketamine can be a really good option. If you have PTSD, OCD, and then, they're doing more clinical studies to see if ketamine is applicable for other things, but the main ones right now, anxiety, depression, PTSD, chronic pain, OCD.
Is it a problem if people do have substance use history or substance abuse history?
That one can be case by case. Ketamine can, it is a substance. It can be addictive, but there is research showing that it can be really helpful actually to decrease substance use in people. But again, that's going to be something that needs to be addressed really cautiously. You need to have the medical evaluation. You need to make sure that you have really strong mental health support and that you're not using it as, oh, well, this is just like another way to get high or whatever, but it's a functional tool. So that one is make sure you're getting treatment for the addiction first type of a thing.
Yeah. Okay. So it's not black and white. A lot of it is like we have to whisk. Oh my gosh, weigh the risks and the benefits for a
Yes.
lot of those
Yeah.
types of things.
Yeah.
This is just random information. I've not looked at studies on this, but there's somebody that I listened to their podcast and they were saying that they have been doing ketamine treatment and it's been helpful for mental health, but also it can harm the thyroid. Is that true? Or is that just like I heard a random thing on some podcast?
That, I mean, on kind of the list of things that I've been given, like when I talk to other people about it, thyroid hasn't been a huge one. And it may be something that, extensive use, it could damage the thyroid, but my non-medical opinion, my gut would say in a small controlled treatment to address mental health, it's probably not that big of a concern. But again, if it is a concern, making sure you have the medical evaluation, talking with the medical team.
Tell us, this leads us into what a typical treatment would be. I mean, is this something that you're doing 17 times, or is this something that you're doing 1 or 2 or 3 times?
So it kind of depends on the structure. So for example, here at Anew, we do the Spravato, which is the nasal one, and then we also do the intramuscular. So standard treatment for the intramuscular is 6 treatments. So you come in 6 times. It's about a 2-hour process. You get 2 injections, and the effect lasts for about 30 minutes each time. The nasal ketamine is not as strong. And so the minimum treatment for the nasal ketamine is 12 treatments.
Oh, so that's a lot.
But insurance has approved more than 12 treatments for certain clients. And so there are some that can do, 17 or 20 or 30 or 40 based on the severity of their mental illness.
I had it in my mind and not off of any information that it was like something that you did 2 or 3 times, like, and then you were done doing it. So that's interesting. And again, that's not based on like, I just made that up in my own brain. So, I don't know.
Can you tell us a bit about, I mean, I know you have confidentiality, but a scenario where a patient or a client has come to see you and you've seen how it's worked. Can you talk us through
Well,
that?
why, you know what? We'll just bypass confidentiality and we'll just go with my own experience.
Oh, great.
Um, I consent. Um, so I have struggled with mental illness the majority of my life. I've had a lot of anxiety, depression, had, harder experiences in childhood. And then losing my child kind of ripped the band-aid off of everything. And I was having full-blown PTSD. And I'd go to the doctor, they'd give me a medication, and like maybe it would keep me so I could like get out of bed and brush my teeth. But I wouldn't say that I was functioning really, really well. And did a lot of therapy and had some great therapists that were really, really helpful, and then became a therapist, right? So like, you know, oh, well, I'm a therapist and if I take an antidepressant and I go to therapy and I practice therapy principles all the time, like I should have really, really excellent mental health. So I actually was like, oh, I'm in a really great place. I probably have the best mental health I've had in my entire life. And where I am now versus PTSD 10 years ago is a night and day difference. And so I just recently did my own ketamine treatments. In November, December is when I did it. And so what was really interesting is I had done ketamine assisted therapy with all of these patients, and I'd seen them their it's the PHQ-9 and GAD-7 are the assessments that we track depression and anxiety with. But I'd seen their scores go down. I'd heard them say that they were feeling so much better, having such great improvement. And it was so exciting to see. Well, then I did it for myself. And I was like, oh, like even with medication and my own therapy and being a therapist, like I still have mild to moderate depression and anxiety. Well, that's dumb. And so doing my own ketamine treatments, I was shocked because after the third treatment, I took my test again and my depression score was at a 3, which is like if you answer one question, you can have a 3. And it was just really interesting to all of a sudden feel and see my own level of healing, to feel like I had more emotional bandwidth for things, to feel less sensitive to hard things going on or stress or chaos. And I thought I had arrived. I thought, oh, this is the best my mental health will ever be. And then just seeing this whole new level of clarity and growth was so exciting. And it's increased my passion and advocacy of like, if you struggle with your mental health, ketamine can be a really, really great tool.
Hey guys, just checking in and want to say if you are enjoying this podcast
And you want to see it keep going, maybe it's helped you through your widowhood journey and you think that it might help others on their widowhood journey, you can support that cause by joining our Patreon.
some of the things that you get as a Patreon beneficiary are ad-free episodes, so you don't have to hear ads like this.
You also get exclusive content, and at a certain level, you might also get an exclusive t-shirt. You can only get that place.
That is true. It's pretty cool. There are 4 different tiers available, so check it out. It's patreon.com/WWDN.
And as an extra bonus, very often you get your names read by one of my kids, and they will do a terrible job with the pronunciation. And that's like a bonus, I think.
I think it's kind of the best. I would much rather hear somebody butcher my name than say it correctly.
A child butcher it than an adult do it correctly. Yep. So go to patreon.com/WWDN to keep our podcast going and support the widowed cause.
Yes! Thanks, guys! Back to our regularly scheduled program.
You just said that you did ketamine on yourself, but I have a feeling that you didn't.
I mean, I didn't do it on myself.
Yes. Can you take us through like what a treatment looks like? I mean, are you just sitting in a chair? Are you talking about things?
So first thing, you're going to get set up with one of our medical professionals here. They're going to do, a 15 or 30-minute phone consult, go over your medical history, what medications you're on, what your history with mental health is. And they're going to kind of scan for, any red flags and just make sure that like this is a safe treatment for you. And if you are approved, then you come into the clinic, you get set up in your private room. I wear my comfy cozies. I bring a fuzzy blanket and sit in the recliner. I take a minute. It's really, really helpful to set kind of intentions of like, well, what's the purpose of this, right? Like I'm trying to, feel a decrease in my anxiety, or I want to let go of any emotions that are, stuck trauma emotions or whatever, right? Have an intention for the session. And so you'll get kind of in your private room, get in your chair. The medical professional will come in, go over your kind of check in, any medical changes, and then they get your dose of ketamine. It's based off of your weight and then whatever the calculations are, starting off pretty mild, and you get your first injection and you sit in the chair for 30 minutes. And ketamine is weird. It's just that's the best way to use it. But you go into a dissociative state. So sometimes you can lose like body function, or your body starts feeling weird, or you see or hear things, right? So you can see lights or images or hear different sounds. But yeah, you kind of sit in the chair, and after the 30 minutes, the medical professional comes in. Was that? Do you think the dose was okay? And then do you want to go ahead and have that second dose? Then they'll give you the second dose, and you sit in the chair for the next 30 minutes. And then after 30 minutes, it wears off. Preparation for that, you fast, no food or water for 4 hours before. And then afterwards, you want to avoid stimulus, right? Like your brain's just gone through a really intense workout and a big healing process. And so going home and trying to hydrate, eat something healthy, sleep or rest. And yeah, you kind of do that. And my favorite way to describe it is our bodies were created to be self-healing. And so if the circumstances are right, then the body knows what to do, right? So it's like if we break a leg, we don't sit there and tell ourselves, okay, body, now send blood cells to the bone to heal the bone. But it's like if the bone is set and put in a cast, the brain knows how to heal it. And I always think like ketamine sets our brain up in the perfect state to be able to self-heal. And so any of those emotional, traumas, anything that's causing the anxiety, depression, the brain can identify it and target it. The brain wants to heal.
So, do you have to be seeing them for therapy also, or do you just do like ketamine a la carte?
You don't have to be seen here for therapy. Here at Anew, that's one of the questions that's asked in the intake. Do you have a therapist? We highly recommend it. Healing is not a linear process, and it is better if we have support and better if you're prepared. And sometimes we don't know the right things or best things to do to help our healing. And so here you can, like we have a psychiatrist, you can do medication management here. We do have therapists on staff. You can come see one of us for talk therapy or integration sessions. You can have one of us in the room to kind of guide you through the actual ketamine session if you feel like that's helpful. But we do suggest that someone have, a therapist that they're currently working with in tandem with ketamine. That is not a requirement for a lot of ketamine clinics or medical clinics. That is, again, just kind of with my doctorate in traumatology, to me, that is a huge value add and brings a high level of support, which more support, I think, gives better outcomes. So that's something that we do really encourage here.
It seems like this is something where you'd really want to make sure that the people who are doing it know what they're doing. Is there any accreditation process, or is there any way to know if like this is the van situation, or like
There is currently not really, really strict requirements, especially if you're doing intramuscular or IV ketamine. There really are not a lot of precautions. But I would say a lot of people, if you know what to look for and you can trust your gut, right? Like I do think it's valuable to have a medical evaluation.
Yeah, that seems
Right?
like you definitely should not go to a place that's not going to do that first.
Uh-huh. And again, me personally, I do think that making sure that they prioritize the mental health component, right? If you're going in to get your anxiety and depression treated, but you don't have any coping skills, or a lot of people don't even realize that they have kind of an underground potential for PTSD, that they're like, oh, I had something hard in my past, but that's fine. I'm okay. Like they don't realize necessarily how those impact us. And so, yeah, I would say make sure there's a medical evaluation. Make sure that they do want you to have support outside of just getting the drug and moving on, that they're providing you those resources and saying, hey, here are the things that you need to look for. and that you feel really safe and comfortable with the staff, that you feel really safe and comfortable in the facility. Things that I think set Anew apart is we really focus on mental health. They actually have monitors, so they're monitoring your vitals the entire time. The medical assistants do not leave. They don't leave without you. They have tablets they carry around. They're watching your vitals the entire time. We're not recording treatments per se, but there is a camera in the room so that if you can, you can get scared in ketamine, right? Or you can feel overwhelmed. And so they're watching if you're agitated, if you're stressed, if you're reaching out for help. They're watching you. There's also a call button in the room. And so there's just a lot of extra layers of precautions so that you have the best experience. One thing that, people who have explored or heard about ketamine, they often hear of like a K-hole, right? Like I had a really bad experience and it was terrible and it was horrible and awful. And I really do think that a lot of that is just due to not having enough support.
You did mention that you had one patient who tried it and it was a terrible experience. What was the cause of the terrible experience for them?
That patient had a sexual abuse history. They were almost 18, but still a minor. And the patient was put in a room by themselves in the dark, and that trauma memory came up. And so they were having a panic attack under ketamine. You can't move as well. You might think you're calling out, but sometimes you can't even call out. And it was dark and scary. And so they started freaking out.
Do the effects of this work better for adults than people whose brains are still developing? Do we know? Has that been studied that you know of?
Um, it doesn't necessarily seem to affect better or worse. Obviously, just with children, we want to be a lot more cautious. The FDA approved version of ketamine, the Spravato, has only been approved for 18 and up. IM or IV is off label, and it can be clinically safe and appropriate for minors. Again, there's a lot of suicidal teenagers right now, and that's probably my most exciting thing is when we have a teenager come in, they're medically qualified, their psychiatrist, their medical doctors on board, their therapist, or I'm the therapist, when we're all on board and collaborating and working together. And instead of them struggling with suicidal ideation for years or decades, we see a reduction in suicidal ideation in 3 to 6 weeks.
This is unrelated to ketamine and more related to your expertise as a therapist. Why are there so many suicidal teenagers? I know that that's all has kind of always been, there's teenagers who that ends up kind of being what happens. But I don't know if it's because we're more aware of it because people are talking about it more, or if it's actually occurring more. Can you talk about
I
that?
would say some of it's that we're more aware. I also think this is a little bit more just maybe my assumption versus actual real science, but we use our bodies differently now than we used to, right? We used to get out there and hunt and plow the fields and I don't know, hike in 6 feet of snow both ways to school, right? Like we used our physical bodies more. And so our body had a big comparison of what is physical pain versus what is emotional pain. And physical pain can come and heal and go away. Emotional pain, it's a little bit harder to escape. And so like we don't have the same physical stressors. We're not worried about keeping ourselves alive. Like my biggest worry most days is the Pebble ice machine at the gas station still broken and I'm going to have to get regular ice in my Diet Coke, right? Like that's like my big worry, right? While I'm sitting on my heated seat with my heated steering wheel. Our brains haven't caught up to the technological evolution that we've had. And so emotions are the biggest physical sensation that we have. And some emotions are painful. And so if you're feeling a lot of pain and you're like, wait, like, why can't I escape this? Maybe I'm the problem. And if we believe I'm the problem enough, well, gosh, like if I'm the problem and people are hanging out with me, like that's really bad. Maybe I'm a burden, maybe I'm too much. And it's really easy you know, for that unhealthy pattern to develop into serious illness.
Wow, that's kind of cool. I hadn't thought about it that way.
The burden part makes sense to me. We talk about within our widow group, and we've talked about this on our podcast before, where there's suicidal ideations or passive suicidality. And some of us have not experienced that until we've had something so big like the death of our partner.
Hmm.
And and I remember like the times where I was my lowest and kind of sitting in that a lot was when I thought I was a burden because I'm just like, I've been trying for so long to be okay. And this is just out of my wheelhouse. And so that part makes sense. I feel like we feel like we need so much help sometimes, and then you don't want to be a burden for somebody else.
Well, and a lot of survivors of, losing someone they love, that trauma creates a fracture and our brain's trying to figure out like, why did this happen? Well, and sometimes loss doesn't make sense, right? It's unfair, it's cruel, it's untimely, it's heavy, but we're trying like, oh, if I can just figure out the why, maybe I'll feel better. And a lot of the why people come up with is, well, it's my fault. I shouldn't have screamed at the person that day. I shouldn't have asked them to go do carpool. I should have been watching better, right? Maybe had I done whatever. And so a lot of that narrative of it's my fault is really quite punishing to the body, and yeah, can have really negative impacts and really cause a lot of complex mental health issues.
I have two questions. One is, what about like people who are neurodivergent? Is it still effective for them? Is it weird? Anything that needs to happen differently for them? And also, I would love to hear you tell us what the risks are.
Anita, I hear we have a store.
Oh, we sure do. We've actually had it for quite a while. It's called the Snarky Grief Shop, and it's where you will find all of our best grief merch. That is, yes, a little snarky. For instance, it's where you will find the official widow card that you can pull and use at your convenience.
You can put it in your wallet, and anytime you need to use it, pull it out, play the widow card.
Yeah, we have glow-in-the-dark stickers. We have shirts that say, "Be nice, my husband is dead." We also have the ones that are not quite as jarring, so that you can wear them out in public and not feel weird. But sometimes you need that shirt.
I wear my "Be nice, my husband is dead" to bed because I'm a little scared to go in public with it. But you've worn it on airplanes before with your kids.
Yeah, every time we go to the airport, I wear that shirt because I'm just like, listen, I got to get all these kids through security. Just be nice to me. Thank you so much. And it's worked for the most part.
Some of the less snarky grief shirts are podcast shirts or Widow Wives Club. We also have Resilient AF, right, Anita? What else we got in there?
Yeah, which we're telling everybody who cares, like Mel's mom, that means American fork, because she can't know what it really means, guys.
Yeah.
Stickers and mugs and notebooks and just cool stuff that you can use to express your snarky grief. You'll find it by going to our website, shop.widowwedonow.com. There's a lot of W's in there, so just make sure that you've counted them and there's the right number.
We will link to that in the show notes, and it's also in our app, which you can get from the App Store. Can people get it from our regular website too?
Yes, if you go to widowwedonow.com, there's a link for the shop in there too.
Great. If you'd like to show your snark or have something a little more subtle, go ahead and check that out. Again, that's
shop.widowwedonow.com.
Neurodivergence, as far as mental health wise, I haven't seen any big complications with that. Again, with neurodivergence, I would just say making sure that there's not any other medical pieces that need to be evaluated. But yeah, it's, again, I've had a couple neurodivergent clients and they've had some really, really great results on ketamine.
Has it helped their ADHD? Just not asking for any specific purpose or anything.
I mean, not asking. I literally, we may have a couple people that are, we're more personally familiar with that are doing ketamine right now, and it's like, can I do my own study? Because like, I sure hope it helps the ADHD. So there's not a ton of research on the ADHD specifically, but ADHD people have high levels of rejection sensitivity. And so I'm like, if they have high levels of rejection sensitivity, there's a good chance that they have, I'm a burden, I'm not good enough, and that can flare symptoms. So I'm hoping that it is something that can be really effective for helping the ADHD, but the science on that is still developing.
Okay. Tell us.
But I'll let you know. Again,
okay.
I'm like tracking a couple people really closely right now, so I'll shoot you a text when their treatments are over.
Great. Like you have to go over, you have to do like an informed consent, I'm sure. And so you
Yes.
have to tell people what the risks are and what are the risks.
Big risk, mental health wise, big risk is if you have like a really, really big trauma experience that you are not prepared for, and that comes up in ketamine, that can be horrifying. Yeah, you can essentially relive your trauma in a dissociative state, and that could be catastrophic. And then again, just medically, it is a medical tool, right? It is a drug used in anesthesia. And so if you have high blood pressure, ketamine can increase your blood pressure so you can have complications from that. You can have breathing issues. But again, that's why you do the medical evaluation. You want to make sure that you're cleared so that it's not a risk. And then I like the medical monitoring, right? Like if a medical professional is watching all of your heart rate, your blood pressure, all of your vitals while you're doing it, then you can see pretty clearly how you respond to the ketamine. And then I would say, addiction is a very, very minor risk, but still a risk. You can also go to places that will track it, right? That have kind of a national database. So you can't do ketamine at one place and jump to another place and abuse it, but that there's kind of that level of protection. And this is the discouraging risk is it's only effective for like 80, 85% of people, right?
Hmm.
And so coming in and expecting like it's going to be some miracle thing and it's going to heal all my problems, just like every other treatment, some people won't respond.
What's the response rate for something like an antidepressant? Is it lower than that, or is it about the same?
Like I would say it's higher. It's really, really, really impressive to see the decrease that people have in depression and anxiety compared to
Traditional
medication.
treatments. Yeah. Yeah.
Yeah.
I just think it's so crazy that you go and you sit in a recliner and you see pink ponies or whatever, and then you're like, I feel better. It doesn't make any sense.
And it literally is the weirdest experience.
I have a question that is sensitive.
Okay, I'll try not to blush.
Do you ever pee your pants?
Okay, I have never peed my pants. Okay, one patient, here's one side effect is ketamine can make you nauseous.
Okay.
And so there was one patient that came in and we weren't sure if it was the Medicare, like the ketamine making them nauseous. Part of me was like, I also think this was like emotional purging, but they were throwing up so hard that
Things happened.
things happened. Um, Ketamine can increase the sensation like you do need to pee.
Hmm.
That's not, okay, here's the thing. I'm the therapist, okay? So like I'm not necessarily helping people discharge at the end of their treatment. So no one that I have done therapy with has peed themselves during ketamine. And if anyone else here at Anew has peed themselves, like I wouldn't know. I wouldn't know. I have not heard that to be a huge issue, except for the one person that was throwing up really hard. I was worried about it. I'm like, people say that it can make you feel like you need to pee. And then one of the medical professionals, like, she's like, then just wear a pad. If you're that worried about it, wear a pad.
Because that's what I was gonna say. If it was a common thing, I feel like you would be preparing people for that, right? Like because from what I hear when people do ayahuasca, like very often they're pooping and throwing up. So I didn't know if ketamine was the same.
I feel like I would be more embarrassed if it was diarrhea from the ketamine. Because like whatever, don't we all pee our pants from time to time?
No, I'm like, no, not diarrhea is not a huge issue. Um, but we'll put down lots of pads for you when you come, Mel, so
Okay,
that you can just have whatever experience you
thanks.
need to have.
What, how does it compare to other sort of like psychotropic drugs like the ayahuasca and the like MDMA?
Shrooms.
Yeah, mushrooms and things like that.
So I haven't done those yet. The one reason
Okay.
I'm more drawn to ketamine is just because there is a lot of clinical research and there is FDA approval on it. But however, MDMA is currently in clinical research for mental health and shows really promising results and almost got FDA approval last year. And so I think a lot of those other treatments, we're going to see them start being more commonplace for treating mental illness. Like I would be shocked if that wasn't something that we started seeing over the next few years. I think my biggest word of caution to people is, they were kind of underground for a long time, and people have used them to just avoid feeling. right? So instead of using it as a tool to like help mental health, it's I have to take it every day or I can't tolerate being around people.
Hmm.
Oh, it's so stressful for me to do whatever. So I just microdose my shrooms and then I feel better. And so the goal is not to avoid feeling, right? Like our feelings are an important physical function of our body. And so for me, I'm like using it off label, that's really hard for me. Using it recreationally or, daily, that's hard for me because I'm like, our emotions are important and serve a purpose. And so I yeah, again, I have done shrooms. I haven't done MDMA, but those I'm guarantee will be more widely used here in the next few years.
Or do you think they work on the same pathway? It's like the same type of a thing that's happening in the brain? Don't know. That's off of her.
I have actually never asked that question.
Well, ask it now
So
to
I'll make
somebody
sure,
else.
yeah,
Okay.
I'll text you.
This is another question that you probably have not the answer for. But what about like the magnets that they're doing on people's brains?
TMS.
Yeah, like what's the deal with that? Is that working? And
TMS,
like,
TMS is also a really great option. And New will start offering TMS hopefully in the next month or two. I haven't studied the science on that, but I do know that that can be really, really effective. But I don't think that that one works on the neural pathways the same way, but it does kind of help create that plasticity similar to the ketamine. So yeah, that one is also a really cool treatment.
okay, so Mel, are you gonna do it?
Well, I have information
Oh,
because I
tell
just
us.
Googled studies on ketamine versus MDMA therapy, but this study came up that's actually currently under peer review right now from Psychology Today's data. So you can get access to their data. And one thing that just I think is good for everybody to hear and remember, long-term mental health benefits do not come from psychedelics alone. They are most effective in combination with therapy framework.
Yep.
So anything you do, I like we mentioned earlier, if somebody goes in and they're like, this is going to be a cure-all and a miracle drug, it's like nothing actually works like that, really, right? Unless
Yeah.
maybe you die, then you're like, great, all my problems are done because I have died.
Well, yeah, I was gonna say our mental health is like our physical health, right? Like if I eat junk food and I don't work out, like my physical health is gonna take a decline. It's gonna hit. We have to like actively make sure our mental health stays.
She's saying that because I'm eating a donut right now, guys.
I'm saying that because I was really mad you didn't bring me a donut, Anita.
So rude.
Sorry.
So there's a part in this article also that says that their data shows for the first time that IV ketamine's PTSD effects were significantly greater in participants who received ongoing psychotherapy. So it sounds like, of course, what you're saying is good, pairing therapy with the treatments and the more support you have,
Yeah.
the better. So
Yeah.
yeah.
And kind of like, your demographic may say like, oh, do I have PTSD? I don't know if I have PTSD. Like, yeah, I lost someone, but I don't know if I have PTSD. PTSD is really hard because we grew up like, oh, if you're not a war vet, if you weren't, run over by a semi truck or you weren't raped, you don't have PTSD. And really now they're showing that people can have PTSD symptoms from chronic exposure to stress or a lot of adverse experiences in childhood or right? Like losing a spouse and then the chronic stress that follows from that. And so, really making sure like you're getting the right support. Grief is complicated because we do need to feel it. Ketamine is really not going to be a great option for someone that's grieving, because they lost their person 2 weeks ago.
Yeah.
Really making sure you've given enough time for like, okay, are we adjusting? How are we feeling? And I feel like that's when an antidepressant or an anti-anxiety are really effective in the short term to make sure that you're getting kind of some extra support and helping with that before you jump into like a heavier duty treatment. But you know, but grief can cause those PTSD responses.
It's so interesting that you said that you thought that you were like at a pretty good level in your life and then you tried it and you're like, actually, I could be better because I think a lot of us think that too. Like, it's not as good as it was before he died, but like it's not as bad as it was for 6 months or
I
two
can
years
brush my
after.
teeth now.
Yeah, yeah. And I'm functioning pretty well. So that's kind of an interesting thought, like, is it actually that good? Or maybe it's not as good as I thought it was. I don't know.
I also didn't realize that this had been researched for over 50 years. That's what is surprising. I mean, of course, we're like the general public, Anita and I, and so we're not hearing about everything when it's in the beginning stages. But that was surprising to me. I just read that on that same article.
Yeah.
So 50 years of research, 10,000 plus sessions just for the people that did this one study for Psychology Today, which they're, of course, not the only people doing
Yeah.
the studies, but
Yeah.
really interesting. And it was also kind of supporting what you said about how MDMA is not hasn't been studied as stringently as far as like in a clinical setting and then having the monitoring. I have a friend that's actually been, of course, it's like underground, doing the little MDMA micro dosing things with someone, and he'll tell me about it, and he's like, it's amazing. It's helped heal my childhood trauma. And I'm like, it sounds so scary, but it's really interesting how these drugs have been helping people for the better, even though they also have adverse effects that we know about, probably from when they were first created, like 60s and stuff like that.
Yeah. Yeah.
I also think it's really interesting, Mel, that we're probably all of the age of like say no to drugs.
Yes.
You know, we all went through the DARE program or whatever. And so it's like, that's a drug. You know what I'm saying? And so you just have this weird, like, drugs are bad. And
I'm sorry, if you went through the DARE program and you're a Utah Mormon or Christian, drugs are bad.
drugs are bad. Like, remember that fried egg commercial?
It was so scary. Yeah.
Yeah,
You're brain
so-
on drugs.
Yeah. Any questions? No.
No, you're like, no, I just won't ever eat eggs again.
Yeah. Yeah.
So scary. Yeah.
Now I'm remembering all of those PSAs, like where the dad found the marijuana in the closet. I learned it by watching you. Or whatever.
I don't think I remember that one.
I don't
I'll
either.
have to find it. Maybe I made it up. When did it become FDA approved? Like, it doesn't seem like you said it's been studied for 50 years, but it hasn't been that long that it's been like insurance companies are paying for it or the FDA says it's okay.
Spravato was just FDA approved in the last couple of years.
Yeah. Okay.
But what's really great about that is it just makes it a little bit more accessible, right? Not all of us have the budget to pay for something off label, have the medical monitoring, have a therapist in the room, right? But you really need the help. And you've tried a lot of things. And so being able to have an FDA approved insurance covered option is really, really cool.
And it just lends legitimacy, you know, like, hey, we actually know that this is what is going to do what we think it's going to do. And it's not, you know, the van situation. Okay.
Poor Larry.
Poor Larry. I know. We're dogging on Larry. We love Larry too.
We do.
Thank you so much, Carolyn. You have given us so much to think about and consider. And I know several widows who have tried ketamine therapy and it's been really helpful for them. And I know a lot of other widows who are scared of it and say, ooh, that's not something I want to try. So maybe this will change some minds, or maybe it won't.
Maybe they'll change some minds and really like, again, drugs are bad. So the fact that I was doing it was really nerve-wracking. Ketamine's also a really weird experience. And so like, you know, making sure like it can be a time commitment, it can be an emotional commitment, but making sure that you have like a support person. It's not something that you have to do by yourself. You can bring a trusted companion into the room with you, that like sometimes having someone there with you makes something less scary, especially where they're not doing it.
Can you do couples ketamine? Like, do you have his and hers chairs or hers and hers?
You know what? Some people do couples ketamine, like they do ketamine at like a really, really low dose, and they say it's really, really helpful. I'm going to have to like test that out with someone who's done it first. I don't, would I want to do ketamine and couples work with my spouse? Like,
I don't think I would want to. I'd be like, I don't want to be around.
So like sometimes you just have weird reactions, right? Like sometimes
maybe
you're
you pee
saying
on
silly
them.
things, or you're peeing on them, or like you're like choo choo, right? You're like sometimes you
It's become a new podcast, new direction.
oh.
Thank you so much, Carolyn. If people are interested in finding out your clinic services, where can they find out more information?
Yeah, they just need to jump online at anewtherapyutah.com, or they can find us on Instagram, Anew Therapy Utah. They can, set up a consult just right through the website and email in with any questions.
Okay, sounds fantastic. We hope you guys have all learned something really cool and new today. And let us know your experiences if you've already tried ketamine or if you're going to maybe give it a go. We'd love to hear.
Yeah.
Thanks for joining us today. If you'd like to keep the podcast going, will you check out our Patreon? It's patreon.com/WWDN.
If you'd like to buy us tacos, go to buymeacoffee.com/widowwedonoww.
If you'd like to buy us a ketamine treatment, also go to buymeacoffee.com. Just kidding. We always appreciate a nice rating and review on Apple Podcasts or Spotify. And until we get to talk to you again, I'm Anita.
I'm Mel.
And I'm Carolyn.
And we are just two young widows and one therapist who's definitely not doing ketamine in her van.
With Larry.
We're all just trying to figure out, widow,
We
do
now.
Mel.
Yeah.
We have a major announcement to make.
Go for it.
Did you know that right now all plans on Mint Mobile are what?
$15 a month.
Okay, that's truly ridiculous. Do you know how much regular cell phones are?
Yep.
$1 bazillion a month. 15 is less than that.
New customers get 3 months of unlimited premium wireless for $15 a month if you sign up right now. And guess what? I use it. I love it. I've used it all over the country, all over the world, and it's great. And if you're wondering about phones, they have those available as well, or you can just port your own number and your current phone over to Mint Mobile. They make it so easy.
So if people are interested in trying out Mint Mobile, how can they go about doing that?
Go to trymintmobile.com/WWDN. And you know, it's interesting. When my dad died, we actually put his phone on a Mint Mobile plan because it kept his number going, but it was $15 a month. So there you go. And there's different storage plans, but you might as well just get the unlimited because it's $15 a month.
Absolutely. All right, go try it today.
That's trymintmobile.com/WWDN.